Hi everyone, welcome back to another episode of the Breast Cancer Physio. I'm your host Jen McKenzie, lymphedema physiotherapist and ESSA accredited exercise physiologist. I'm back here today with my wonderful breast cancer counsellor Julie Bolton, so welcome back again Jules. If you didn't see our last video, that was on understanding the emotional impacts of breast cancer. Go and check that out because that is a wonderful video to watch if you're not sure why you're experiencing the emotions you are around breast cancer. So in this episode, we're going to be talking about a really important topic that affects a lot of people during and after breast cancer treatment, which is brain fog. Jules, this was something that really hit you hard as a survivor, but then some years later you went on and actually did research on brain fog, which I must say I'm very blessed to feel the benefit for my patients on, because obviously this is something you're working with our patients on all the time. Can you tell us what exactly brain fog is and how it impacts people?
Yeah, thanks Jen. So yes, certainly it's a topic that's very close to my heart. And you know, for anyone out there who's experiencing difficulties with memory, concentration, paying attention, decision making, retaining new information, processing information, just managing to coordinate and organise themselves and their families, then you know, my heart really goes out to you.
Absolutely, yeah. And it's always, I should put a little caveat in here and say that whenever you're talking about brain fog, you often will, you know, stumble for words. I always find it always quite a bit hilarious that, yeah, whenever the topic comes up about brain fog, I start getting like my words mixed up. So anyway.
I think it's something that really impacts on people's lives in many aspects of their lives in ways that other people find difficult to understand. And I think, you know, on top of everything else, there's often a real fear for people because they fear, you know, they don't understand what's happening and they wonder, am I now getting Alzheimer's on top of everything else? You know? And that can be a very real fear as well. But what we know is that up to 75% of breast cancer survivors actually experience we call it cognitive concerns. Cognitive is just to do with our brain and our thinking, which is a very large number of people.
Yeah, it's huge, isn't it?
To different degrees. For some people it might be for several months, and for others it may be up to several years. A lot of people notice a difference, you know, within the first year or so after treatment. But there's been a lot of research now done on what the scientific literature now calls cancer-related cognitive impairment. So CRCI is what it's called now. But you know, you'd remember, Jen, that it used to be called chemo brain.
Chemo brain, exactly, yeah, which is leading us to our next point, which is that it's not actually just chemotherapy that can cause brain fog, is it? Hence why the term chemo brain is sort of now out of date, is that correct?
So interestingly, it was back in the 90s before, I guess, the scientific world started to listen to women who were saying, you know, my brain's not working properly. And now we have so many people surviving breast cancer, which is great, but we've got to learn to manage some of the after effects of treatment, and this is a significant one. So it wasn't until 1995 that the first researchers, Weinecke and Deinst, found a link between chemotherapy and cognitive issues, and therefore the term chemo brain sort of started to come into use. Although I have to say it took a long time for some people to take that seriously. You know, it used to be dismissed and kind of laughed off as a bit of a joke, and I assure you it's not a joke, because a lot of people who are experiencing it would be able to attest to.
And I suppose on that point, just quickly, whenever anybody comes into my clinic, even though they're coming in for physiotherapy related topics, if I pick up, you know, like I can sometimes ask a patient, like, what date was your breast cancer surgery? And it may have been surgery within the last, you know, 3 months, and they cannot remember the date of their surgery, and they'll say, oh God, this is my brain fog kicking in. At that point, I'm often referring them to you or mentioning that, you know, this is something that can actually be treated, because I think we're aware of it more so these days, but to actually have it treated is a totally new thing as well.
But interestingly, since the days where the link was made between chemotherapy and cognitive problems, there's been a lot more research done, and what we know now is that it's likely a multifactorial. In other words, there's a lot of reasons for that, and it's definitely something that people can experience even when they haven't been through chemotherapy. So some of the underlying causes we now know, or things that contribute to this, can be firstly that initial shock of diagnosis, and I guess that links into what we talked about in our last video about flicking up into hyperarousal, and that shock and difficulty of thinking clearly, we know when we're in that state. Certainly we know that there is some neurotoxic effects of chemotherapy that can pass through the blood-brain barrier. We know that adjuvant hormone therapy, so things like tamoxifen and letrozole, because they affect levels of estrogen in the body, we know that estrogen has a protective effect on the brain, and so we know that we now have evidence that they can be contributing factors as well. We know that often when premenopausal women go through chemotherapy, they are instantly thrust into menopause, and so once again it's the change in estrogen levels which can impact. We know that other things like an increase in inflammatory markers, a decreased ability to metabolize the stress hormone. We know that things like depression and anxiety can definitely impact on our ability to think clearly, to remember, to concentrate. So there's all of these things, on top of which I think it's something like 25% of people who've been through breast cancer, and I suspect this is very underreported, actually experience like post-traumatic stress disorder.
I would agree with that. Absolutely, yeah. And with all of those contributing factors, Jules, it's really interesting listening to all of those. I certainly didn't know all of those myself, and hearing them, it becomes quite evident that this is not just brain fog caused by a little bit of stress because of the situation of breast cancer. There actually are physical changes going on in the brain and the body, essentially, that have been shown to cause brain fog.
Yeah, and this is something that I found fascinating because when I went on to do some study later on, I was really wanting to get a handle on this and find out what's causing this and what can be done about it. And so now that we have improvements in technology, we have PET scans and we have MRI imaging, and we can actually take images of the brain and we can compare the brains of people before and after treatment, or we can compare the brains of people who are having cognitive issues. There was interesting twin studies done in America, one twin had the breast cancer treatment and one hadn't. And what those images are showing us is that there are actually regions of the brain that have definitely been affected by the whole breast cancer experience, including treatment. And in those areas, such as the hippocampus and the frontal lobe, there is decreased neural activity, so less connections happening between the neurons in those areas of the brain. And interestingly, those areas of the brain are the areas that are responsible for things like language and also for memory and planning and coordination.
And it's interesting, isn't it? Because even though on one hand we could go, oh geez, it's a bit scary to realise there's actual physical changes occurring in my brain off the back of breast cancer treatment. At the same time, like we spoke about just before we started recording this video, to have that validated is so important to the patient, that it's like, this isn't just you getting into a stressful state. There are some physical changes occurring here that are causing these symptoms.
Absolutely, and it can be really, really scary to be experiencing some of those changes. The sensation of not being able to remember something that someone just told you, or not to be able to recall names of people that you've known for a long time, or the names of items that you use every day. That can be a very scary experience for people, and it can really affect your confidence as well. So, further to that idea of certain regions of the brain being affected, what we also know now from this imaging is that it seems that because the brain is neuroplastic. In other words, it's constantly changing and reforming. It seems that we're able to utilize other regions of the brain to do some everyday tasks that other people don't need to use. So, you might use sort of section A and B, and because A isn't working properly, this person might use C and D and E.
Right.
And so therefore there's an extra cognitive load on our brain. In other words, it's much, much harder to do just everyday things. And that would explain the extreme mental fatigue and increased distress that people go through. And anyone who's in that experience would be able to recall situations where, sometimes you just feel like you're kind of going in slow motion, through the muddy water, like trying to keep up or trying to process information. So, if you think of, I often talk to my clients about, if you think of a long grassed paddock and you're trying to ride your bike through it, through a pathway that hasn't been used much before, there's a lot of resistance. It's quite hard to pedal your bike through. But the more you go backwards and forwards over that pathway, the flatter that track gets, the easier it is.
That's a lovely analogy, isn't it?
That's how we build these new neural pathways. So the more you do it, the easier it gets.
Which, again, similar to the previous video you and I did on the emotional impacts of breast cancer and being able to bring yourself back into that window of tolerance. Again, the take-home message from this video, guys, is that we are going to talk to you about strategies around helping you with brain fog, because I think that's a really empowering message to hear. With if you've got any issues after breast cancer, if the patient is aware that there's a solution or something that can dampen the side effect, that really encourages the patient. And on that note, you did do a lot of interviews with your research with breast cancer patients. What were the common themes that you found that were problems from brain fog for these patients?
So it certainly aligned with a lot of the worldwide research that was also being done, and they can be grouped into categories. So what people are reporting over and over again is that it impacts their ability to just do everyday tasks. It impacts their ability to socially interact with others and impacts their relationships. It can impact their ability to return to work in their previous capacity, and it can certainly have an impact on their emotional health and well-being. So really significant.
That's big areas, isn't it? Absolutely. So from that, what are some of the strategies, if we sort of break down each individual area, what are some of the strategies that people can utilise?
Okay, so if we just look at, first of all, challenges with tasks of everyday living, the first category. So that incorporates a lot of things. So people reported things like not remembering to close the front door, lock the front door, or lock the garage door when they leave home, right through to really quite serious things like, not remembering to pick up the kids, for example. People reported difficulty with driving because that's a very complex task that requires, multiple things happening at once. So multitasking is something that we know is very difficult if you're having cognitive issues. And multitasking involves a lot of our everyday tasks, such as cooking, for example. So people might, put veggies on the stove and turn it on to high, and then they turn around to do something else, and then they get distracted, like, I'll just go and get the washing off the line, and then they forget that the potatoes are boiling on the stove, and next minute they're boiling dry. I had people tell me in their interviews that, they'd open the oven door the next morning and find the potato bake in there that they meant to have with tea the night before.
Nice. And I think on that note, a lot of people who get breast cancer, of course, are predominantly women who, as by nature, I think we are multitaskers, particularly if we've had children or if we've been grandmothers, if we're working at the same time. Multitasking becomes just a normal thing for women. So when that falls down in a heap, that must be quite distressing.
Yes, it is, and it's very mentally fatiguing, and at the same time, you're feeling very, you don't understand why it's happening, and you're quite critical of the fact that you're not able to manage. So it's important, it affects our everyday life in other ways, like not remembering to attend appointments, which is a really important thing as well. And all the way down to things like walking into a room and not remembering why I walked in there. And I mean, these little things happen to people sometimes
normally.
Anyway, especially if they've got a lot on their mind or there's other adverse things happening in their life. But when it's happening all the time, it can be very stressful. So some of the things that can be really helpful are just to organise your days as much as you can. So to have diaries, calendars, things on your phone, to have reminders, to have alarms on your phone. I know I use the alarm on my stove a lot when I was cooking, so I automatically, in fact, I still do it now because it's become a habit. You'll put something on and you'll set it for 10 minutes later so that you come back and make sure you've turned it down. Sticky notes, great.
Yes.
You can put a sticky note on the back of the door so that as you leave you remember to lock the door. These things sound unnecessary to other people, but when you're right in the thick of this brain fog, they're really
super necessary.
Simple.
And again, right back to what we discussed in our last video about the simplicity of the solution sometimes. Even though it is that simple, if you do it, it will impact your day in such a positive way.
That's
where
right.
It doesn't have to be something super complex to solve some of these issues.
It just takes the pressure off a bit too. I suggest you have notebooks everywhere. So, you can have a notebook next to your bed at night. So instead of worrying about remembering something in the morning, if you just write it down, then you can stop thinking about it. You might have a notebook, in 5 different places, so that you just write things down as you think of them. But all of these also help to give you back a little bit of a sense of some control over the situation, which in turn is going to reduce your level of anxiety.
And I think if there's ever the most important thing any health professional or any person can do for a patient going through breast cancer, it's that sense of control for the patient, isn't it? Because breast cancer by itself whips away that control for so many, and so any small thing that can be helping the patient to regain a sense of control is just incredibly empowering. So
should we move on to the second category, which are the impacts on people's social interactions and relationships? And I think other people don't really have a sense of how much this can impact in this way. But if you're having difficulty recalling words, even simple words, like you go to ask for a cup and can you pass me that that thing that that you drink water out of, that's embarrassing.
Absolutely.
And that straight away makes you feel very stressed and very anxious. And so over time people lose confidence and they tend to withdraw from social settings because they can't trust themselves to remember. Also have difficulty keeping up with conversations that are moving very quickly and lots of fast backwards and forwards banter because we know our processing speed is much slower at that time. And so what I suggest is that just for this period of time, you limit your social interaction to smaller groups of people that you've perhaps known for a while and people that you trust enough to explain to them what's happening for you. Also just educating your family and loved ones about this being a very real phenomenon, that it's not just you. Maybe show them this YouTube video.
I was going to say that I think that's another reason why these YouTube videos are quite powerful for so many, is because at least if you can't explain it to family, friends, colleagues, shoot them the link to this video and it will certainly make a lot of sense, I think, for them to listen to this education.
I think that extends into our next category as well, which is the difficulty that people often have around going back to work, which is a very big issue for a lot of people. Depending on the extent of their cognitive issues, once again, it can be really challenging to imagine trying to go back to work knowing that your cognition is not what it normally is.
Absolutely.
Particularly if your work involves a lot of multitasking or a lot of higher order thinking, where you've got to be really on the ball, or where slip-ups can, have catastrophic events. So that again increases our stress levels. And we talked in the last episode about the snow globe analogy and how often after cancer our perspective changes and the landscape looks a little bit different. So that can also impact on our, I guess, sometimes a fear of going back to work and back into that stressful environment that we know is there waiting for us, and not feeling like we might be able to manage that at the moment with our reduced brain function, but also B, whether we actually want to put ourselves in that stressful environment again.
And I think it's always a bit of a trick as well, because for a lot of people who've gone through breast cancer, there's a financial strain, so the pressure to get back to work can be a real thing.
Yes.
And so this is another huge gap, I feel, in the system. And certainly this is a video topic I'd love to cover separately again, which is essentially return to work for breast cancer patients. And she doesn't know it yet, folks, but there's a wonderful occupational therapist that I'm good mates with who is a breast cancer survivor, and I'm really hoping Margie will like to come on and do a YouTube video on this very topic, because I think it's a really big gap in the system, isn't it?
Absolutely. So for those people that are going back to work, or who need to go back to work, how do they manage that? So I would absolutely recommend a very slow transition back to work, like not just going straight back to full-time work, but trying to negotiate a slow transition where you might just go in for a couple of hours at a day, because you're going to have that mental fatigue from trying to manage the tasks that you need to do. I suggest that you have notebooks so that you can write things down when people tell you, maybe asking your colleagues to email you information rather than just telling you on the run in the hallway, because you know that you're not going to retain that information. And I know people that have had to actually make themselves little manuals for things, because trying to learn new information is just difficult to retain. But anyway, we'll leave that topic for the other day. But
I was also just going to throw in as well, back to quickly the social elements of brain fog. I think again that's where attending a breast cancer support group, or at least having a couple of people you can connect with who have gone through breast cancer, can be so beneficial, because they can understand that as an issue. So the embarrassment factor of not knowing the word cup as an example may be quite diminished, because they know, and that's so important.
And they get
it. They get it. Exactly.
Absolutely. So you're right. I think that that's really important, to seek out other people who've been through something similar to you. We know that that's a really important part of getting through this difficult period of time, to be to find other people who understand or who get it. So whether that's educating people around you, whether that's talking to people like ourselves that have more of an understanding of what's going on, whether that's joining a support group or a small group of people who've also been through cancer, to have that common link. There's a sense of relief that other people just get it without you having to be embarrassed or
justified, essentially. Yeah, absolutely.
Of course.
Yeah.
And so the last category, should we move on to that one?
Yeah, absolutely.
So that was really obvious that there was a big correlation between people experiencing cognitive issues and their emotional health and well-being. And I guess you can understand that, because people are constantly experiencing this frustration and embarrassment about not being able to do the things that they could do before. And so there's a real sense of loss around their capacity, or their capability, and a fear of what's happening. Will I ever get it back? Will I get my brain back again? Is this getting worse? Am I likely to get Alzheimer's? There's a lot of people
have those questions.
And there's a bit of a sense of a loss of our sense of self, because the person we are now might not align with the person we remember ourselves being beforehand. And that's a very big deal for people. It's that sense of identity and who we are, and especially for people who have really valued their capacity to be articulate and to function at a high level in their careers, and suddenly feel like their identity is not what it was, and there's a lot of loss around that. So
absolutely, yeah.
This really does impact on people's emotional well-being, and can cause a lot of anxiety, and it can cause depressive symptoms as well. So it's really important to I guess, as we said before, make sure that we surround ourselves with people that understand it. So psychoeducation for our family and our friends and our work people as well, work colleagues. Seeking out some individual counselling with a counsellor or a psychologist who really has an understanding of the impacts of breast cancer, and surrounding ourselves with people via, as we talked about before, support groups and other small group forums of people that have been through something similar.
I think the other thing that's beneficial there too, Jules, is the idea that other people who've been through it may be able to offer some really great suggestions of what's helped them with their brain fog issues. So it doesn't necessarily have to be that you have to go to somebody formal, but I think there's a fantastic interaction between breast cancer survivors where they can empower each other because of tricks and tools that they bring on their own journey.
We also know that just slowing everything down, taking the pressure off a little bit, can be really helpful because you are processing things much more slowly. We know that things like yoga and Tai Chi and Qigong, all of those type of things are really helpful. Definitely mindfulness as well, which we talked about in our last episode. Mindfulness is a way of helping us to stay present in the moment. So a lot of our anxiety and is about past and future. So all the things that have happened, our hurts, our disappointments, our regrets, are in the past, and the future is all the angst and worry about what if, what's going to happen to me, what's going to happen to my brain, is my breast cancer going to come back? So all of those things are really instrumental in us feeling very anxious, and what we're doing with mindfulness is learning to stay present in the moment and being aware of what's happening in the now. So as we mentioned in the last series.
We'll do a separate video, I think, on mindfulness. It's such a big topic, isn't it? So we really need to dive into that.
But just to let people know, they can access some small group mindfulness classes at the Mackenzie Clinic, or online as well as an option.
We'll put the description bar. Sorry, we'll put the link to the mindfulness group in the description bar, and make sure we get you that information. Cool.
And just finally, exercise. We didn't mention exercise. Yes. So exercise is a really big one because we know that exercise helps to release those natural endorphins in the body, our feel-good chemicals, and we know that can be really beneficial.
And I'm assuming also the blood flow to the brain is quite important for. Is that actually been found in the research, or is that not necessarily a link?
Well, I suppose that when our brain is well oxygenated, it's going to be functioning as optimally as possible.
Sure.
And it's not going to reverse, I guess, in the short term the changes that have happened. But it's going to optimise that oxygenation to the brain for sure. Because I'm often advocating exercise for cognitive impairments because of the research, as you've spoken about to me in the past, that is beneficial. All right, well, that's probably going to be a wrap there, guys. I think, is that everything you wanted to cover? So thank you very much for watching this video, everyone. I hope you've gained some really good information around brain fog and also the strategies that you can use to dampen the effect of brain fog. Thank you very much to my guest presenter, Julie Bolton. I'm sure she'll be back again. If you have any comments on this video, please leave it in the section below. Remember to subscribe to the channel and hit the big like button. I'll be back next week with another video. I'll see you then. I'm Jen Mackenzie, the Breast Cancer Physio.